Hello and welcome everybody. This is Floating from Fitness for Life on the Connects, Learn, Move, Breathe channel here. Remember, subscribe, click the bell button so that you get notifications whenever anything comes up on the channel. So, last post I put up was about the awareness that there are muscles that are creating movement and muscles that are stopping movement. So, agonist and antagonist as they call. But let's just keep it with movers and breakers. It's easy to understand that way. Now, when we are utilizing that knowledge, that connection, that awareness in our body, then our movement starts to change a bit. So the connection when we move starts to become different. Now, before we can change anything, we need to become aware of it. Once we become aware of it, then we can start to integrate it into our movement. Until then, it becomes just another movement that we do, something that is something that we are not aware of anymore. It just happens. So, like walking, most of us are not really aware about when we walk. We're just walking around. So, what we're going to try to do today is we're going to do a little bit of mobility exercise, just an easy to do mobility exercise. We're going to go down on the floor and in what we call a shin box or a 90-90. So when I'm sitting in this shin box, remember nothing is supposed to be hurting when you're sitting here. The further I'm out to the side, the more I lean back, the less tension there's on my knees and on my hip. But I'm going to try and sit as upright as I can. On this exercise, please use your hands on the floor just as to support, but they're also a way to connect your body and the floor. So here I'm in a better connection if I'm sitting with my hands off. Now for other exercise we might do the hands off approach, but for this, please put your hand on the floor. What that also does is that it gives you an awareness of where your upper body is. So if I'm sitting here, I might start by turning my upper body. If I put my hand on it, I can direct my body and the way I move differently. It gives me an awareness of where my upper body is. So, what we're going to start off by doing here, sitting in this 90-90 in the position that we can without any negative tension. So, you shouldn't feel any pain in your knee, in your hip, or in your ankle, or in your back. The first thing we're going to do is just try to push your hip forward. So, I'm trying to find tension in my glute. I can always do the touch test. Do it on yourself, please. But put a finger on your bum and then feel tension. Now, if that's hard to feel, then you might have to go where there's no tension and then put your finger in and then try to push your hip forward and feel that tension as it kind of comes down and forward again. Now, as I'm not just letting go back, because I want to use the fact that there's muscles on both sides. So as I'm pushing my hip forward and then I'm pulling myself back. So I'm pushing my hip forward and I'm pulling my hip back. So try to feel the difference from just pushing your hip forward, you feel that glute firing, and then just letting go. Pushing the hip forward and letting go. And then try to push your hip forward and then pull yourself back. Push your hip forward and pull yourself back. Now, as I'm pulling myself back, you almost feel the urge to kind of lift your knees up. And then I can flip over to the other side. Now, I'm using, again, my hands on the floor, so I feel supported. I can make sure that if something is hurting, I can stop. I don't need to just fall back. I'm in a situation where I have no support, so go easy on it. Once I'm over on the other side, I can then again push my hip forward, feeling that tension on that glute, feeling how that's starting to release up around my upper back, and then I'm pulling myself back, and as I'm pulling myself back, my knees are lifting, I'm shifting over to the other side. Now I go from the pull and back into the push forward with the hip. Now my upper body starts to turn a little bit more because I'm following the direction of my hip with my upper body, and then I'm pulling myself back again, slowly lifting the knees over on the other side, and then starting to push my hip forward, and then my upper body starts following further forward, further along. And from here, once I have that full extension of the hip, I'm pushing my hip forward, feeling that tightness in that glute. I can then pull my upper body down towards the floor. So now I'm starting to work on my upper body as well. So I'm pulling around, and then I'm pulling my upper body down towards the floor, as far as I believe I can. Then I'm pushing the floor away from me again. I'm then pulling my hip back, turning again supporting my hands on the floor. Once again, around again, I push my hip forward, feeling that glute firing, activating, upper body down. I feel myself pulling my upper body down towards the floor. My shoulders are down, upper body down as far as I can, back up again, and then pulling my hip back. Now if you start feeling this is way too many informations, then just go back, start with pushing the hip forward, feeling that tension, and then trying to pull yourself back. And see if you can feel a difference between the pushing and pulling, or just pushing, releasing. And see what happens in your body once you start that pull back with your hip, and you feel that your knees wants to lift off the floor, and slowly go to the other side, and then push your hip forward again, compared to just letting go. I'm just kind of sitting down. I'm feeling almost a little bit heavy down to the floor when I'm just letting go. So now I need to re-engage to lift my knees. But if I push forward and then pull myself back, then I already have that tension. Now I haven't mentioned your core at all in this, but if your core is firing normally, then you should feel that as you're pushing your hip forward, you feel your core engaging as you're pulling your upper body down towards the floor. And then as you're coming back up, that pull back with your hip again is activating your core, so you feel your upper body and your lower body is connected. If you feel a disconnect between your lower and upper body in an exercise like this, then there could be some core activation that we need to do, but we're going to address that on a later video. So just try to play around with this and feel that push forward, feeling that hip engaged, that glute engaged, seeing how far can you get your upper body down. And as you're walking down, working down towards the floor with your upper body, try to keep your elbows close and your shoulders down and packed. Now you don't need to go down as far as I do. Feel where you can go. Back up again. I'm already pulling my hip back. And as I'm pulling my hip, I feel the lift of my knees, supporting my hands on the floor, pushing my hip forward, feeling that my upper body wants to walk around. I have my shoulders down and I pull myself down to the floor. And then I can push myself back up and I can pull. So an exercise like this, the Shin Box mobility exercise for the hip, really great for the hip flexors, the low back, that rotation up through the spine, becomes a push and a pull exercise instead of just working on your mobility. But that push and pull keeps you connected. So as I'm pulling my upper body down towards the floor, I am resisting that movement a little bit with the muscles that's going to pull me back up again. And that's going to create stability on both sides of my joint, so I'm not putting too much stress on the joint, but I'm keeping them nice and stable and can work that mobility into my body. I can decompress my joint, I can lubricate my joint, I can get into pain-free motion and just start to work on that push and pull through the hip, down through my hands. We're going to work with this in all kinds of different exercises, but this was what I had to show you today. Try it out. Please comment, remember to subscribe, and then I'll see you soon again. I think that something really good is going to come out of this on different programs and everything. I have all kinds of different stuff in my head that I want to show you guys. Just try to give you a little spoon at the time and then see where it evolves to. So have a great day out there. Take care, and yeah, just take care and have a great day. Bye-bye.